Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we are going to discuss about local anesthetics. So, what are local anesthetic agents? Local anesthetic agents are those that produce a reversible loss of sensation in a localized part of the body when applied directly onto the nervous tissues or mucous membranes. So, this means that the local anesthetic agents or the local anesthetic drug, it actually reversibly prevents the transmission of nerve impulses in a specific region where it is applied without affecting the consciousness. When we look towards the history of local anesthetic, the first local anesthetic agent discovered was cocaine in 1884. So the local anesthetic agents, they actually act on the afferent nerve fibers, or we can say the pain nerve fibers, and inhibit it or prevent it from transmitting impulses, pain impulses. So in this figure you can see this is the cell membrane of the neurons. So you have to keep in mind that the inside of this cell membrane, it is negatively charged. In the inner side of this cell membrane, definitely the concentration of potassium ion is very high, or on the other hand, the concentration of the sodium ion in the outside or extracellular space, it is higher. As you can see, there is sodium in this figure. So normally when action potential takes place, the sodium enters and it increases the positivity inside. Now you can see in number 2, a local anesthetic is administered in an unionized form which diffuses very easily across the cell membrane because it is lipid soluble. By unionized we mean lipid soluble in nature. But as soon as this local anesthetic enters across the cell membrane to the inside, you have to keep in mind that physiologically the pH here is slightly acidic. As soon as this local anesthetic enters, crosses this membrane, it is no longer lipid soluble and now it becomes ionized. Like we have discussed this concept in the very early chapter of the introduction of pharmacology. And you know that if a drug is in ionized form, it cannot easily cross the cell membrane and move around like a lipid soluble drug. So now what happened is that ultimately this local anesthetic, which is no longer lipid soluble due to the slightly acidic pH inside the cell, it is now in the ionized form and now it attaches or bind to the inside of the sodium channel. As you can see in this figure, La positive. By positive we mean that it has become ionized charge, and now it from the inside it binds to this sodium channel and prevents the entry of sodium ions. So ultimately it prevents the propagation of the impulse. You have to keep in mind that a local anesthetic, it actually prevents the generation and conduction of the nerve impulses, and it does so by physically blocking the sodium channels. So it is a sodium channel blocker. So it means that when we locally apply this drug to an affected area, the nerve impulse transmission will be inhibited from there and it will not reach the brain. Ultimately, there will be no pain sensation felt. And you have to keep in mind that local anesthetics, they act very good on small fibers as compared to the larger ones. Their function is better on the myelinated neurons as compared to the non-myelinated ones. You have to also keep in mind that local anesthetic actually, when administered locally, they also cause vasodilation. And due to this reason, they have a shorter duration. So to increase its duration of action, a vasoconstrictor can be added with that local anesthetic so that it remains there for a prolonged time in that site and act. Lignocaine is the most commonly used local anesthetic which has intermediate duration of action. Now further we will also discuss about regional anesthetic. Well, regional anesthetic actually, in them we use local anesthetic to block sensation of pain from a large area of the body such as an arm, leg or abdomen. There are three forms of regional anesthesia. Number one is spinal, number two is epidural, and the third one is also known as IV regional anesthetic. So in case of spinal anesthesia, local anesthetic is actually put into the subarachnoid space, you can see in this figure. Whereas in case of the epidural anesthesia, the drug is administered in between the spinal bone and dura mater. As a result, the pain and sympathetic fibers are blocked, which leads to analgesia and vasodilation of the lower limbs. When we compare the epidural anesthesia with the spinal one, epidural is more safer. Because in case of spinal anesthesia, the drug is in contact with the CSF and it can very easily spread to the brain. In the field of obstetrics, epidural anesthesia is very commonly used, while spinal anesthesia is also used in different orthopedic surgeries for major operation on leg bones or joints.